Put the peace sign. The peace sign.
Thank you very much.
Very good. Thank you, everybody.
How about every Thursday, just like this? By now, we've all heard about the Senate's historic reform plan. This reform plan deals with health care. It saves lives, it saves money, and it saves Medicare. And you've heard how it'll do each of these things by guaranteeing affordable care for every American, slashing the deficit, and rebuilding our economy. So you've also probably heard about where we're going. I want to take just a moment to appreciate just how far we've come. This bill is not just a milestone along a journey of a few months or even a few years. We've been working to reform health care since the first half of the last century. As the Senate heads down this home stretch, I'm going to read just a short piece from a long letter by a former senator about the urgency of action on health care. This man wrote to Congress, and I quote, "Millions of our citizens do not now have a full measure of opportunity to achieve and enjoy good health. Millions do not now have protection or security against the economic effects of sickness. The time has arrived for action to help them attain the opportunity and that protection." He went on to write, this former senator, "People with low or moderate incomes do not get the same medical attention as those with high incomes. The poor have more sickness, but they get less medical care." He went on to say, "We should resolve now that the health of this nation is a national concern, that financial barriers in the way of attaining health shall be removed. That is, the health of all of its citizens deserve the help of all the nation." Again, the health of all of its citizens deserve the help of all the nation. That former senator was Harry Truman. And he wrote that letter to Congress on November 19th, 1945, just months into his presidency, and exactly 64 years ago today. He knew that the health of the American people is linked to the health of the American economy. Way back then he knew that. But since President Truman demanded that we make it easier for every American to afford a healthy life, we've only added millions more to the number who cannot have health insurance and don't have health insurance, and only added billions more to our deficit. This is how long we've waited. A man or woman who turned 1 year old the day Truman issued his call to action, but who has lived his or her entire life without the ability to afford health care as it got more expensive each year, would just today, November 19th, become eligible for Medicare. Generation after generation has called on us to fix this broken system, and we're now closer than ever to getting it done. What we do in the next few weeks will ensure that in the coming months, insurance companies will not be able to deny health care to people who are sick. It will ensure that in the coming years, families will not have to choose between their mortgages or their medicine. It will ensure that in the coming decades, we'll leave our children a better inheritance than a deep deficit and a broken health care system. And it will ensure that 64 years from today, future senators will read about this generation's call to action, not with an apology, but with appreciation that we chose to be on the right side of history. We're going to hear now from a partner I've had in this for the last many months, Senator Chris Dodd. Well, no.
Thanks. Thanks. Well, first of all, let me begin by thanking Majority Leader Reid. Moments like this don't happen accidentally or miraculously. They happen because you have a leader that does not bow, does not back up, but plows forward, even during the difficult weeks and months we've gone through over the past year or so as we've tried to formulate this package that we presented last evening. And so every American, whether you agree or disagree with every provision in this proposal, owes a deep debt of gratitude to the senator from Nevada, Harry Reid. Couldn't happen without it.
Hey, Harry! Hip, hip, Harry! Woo! Woo!
As all of you know, I'm somewhat of an accidental participant in all of this. There should be someone else standing here this afternoon by the name of Ted Kennedy, who was the one who championed this, besides Harry Truman. I think Ted Kennedy was the strongest advocate for health care reform that this country has seen in the last century or so. And so I want to acknowledge him and thank him, as we all do, every single day, as every American ought to, for his tireless efforts. And assuming the responsibility, along with Tom Harkin and Patty Murray and Jeff Bingaman and so many others in our committee over the last number of months, concluding on July 15th, of putting together the Help Committee proposal, half of this equation that has resulted in the bill that the leader has now announced. I'm sorry that Max Baucus isn't here, my good friend and colleague, who, as many of you know, his mother is ill and he's in Montana with her. But Max Baucus and the members of the Finance Committee, people like Chuck Schumer, who's here, and so many others, played such a critical role in bringing that to pass. So we thank Max for his efforts. But this is an opportunity that comes oh so rarely to any Congress to make a difference for 100% of your fellow citizens. On law bills on the past, all those we deal with fractions of the population, important issues. I don't minimize them. But in this proposal, we will improve the quality of life of every single American for literally decades and decades to come by increasing that access, reducing cost, and improving the quality of health care for all Americans. For the first time, we're going to allow the American consumers to be involved in a buyer's market when it comes to insurance, not a seller's market here, where the insurance industry decides what's going to happen. For the first time, we're going to say to seniors, you are going to get the kind of protections not only with Medicare, but also older Americans who haven't reached that magical age that I have, of 65, but still feel we'd like to have that kind of health care that you need. To see to it you're going to have the quality of care, the benefits available to you, to see to it that you have the protections you deserve as Americans. For those who have health insurance and have never had to use it, we want you to know it's going to be stable. It's going to be there when that moment does arrive, as it does for every American family, when you have to access this system and discover it isn't quite what you thought it was. We provide this